Good afternoon. Rich Fitzgerald, County Executive. I'm here with Dr. Deborah Bogan, Director of the County Health Department. Over the past few weeks, our schedules, my schedule and that of everyone else, has been anything but normal. I'm still coming to the office daily, but following the advice of Dr. Bogan, I'm practicing physical distancing. I'm still communicating with administration and staff, particularly health and emergency services, as we ensure that we have what we need to keep providing the services to our residents during this pandemic. We continue to work virtually with our partners at the federal, state, and local governments and collaborate to ensure that the needs of our community are being met. We continue to have ongoing virtual conversations with business organizations, foundations, universities, labor unions, and others about the challenges they face and how we can continue to help each other. We've been very grateful for the response via email from individuals and organizations across the county for their generous donations of masks, gloves, gowns, and other items being used by our emergency responders and medical communities. We continue to accept those donations, and if you're interested in participating, please email us at COVID-19 donations, COVID-19 donations at AlleghenyCounty.us. What I am not doing is having in-person meetings or attending events. We are practicing the physical distancing for which Dr. Bogan and so many others have advocated. And we continue to ask you to do the same. And I'm going to touch on a couple of different areas where we've heard some anecdotal evidence of where maybe people aren't practicing this. While most people are, there's a couple areas where we want to touch upon. In our parks, and I'm going to talk about that one in more detail in a minute, we certainly encourage people to go outside, go for a walk, go hiking, go biking, go jogging, keep a distance. Secondly, in our grocery stores and our supermarkets, we know people are going out. They have to go out, obviously, to purchase food and medicine and other things. We want to make sure that people keep distance in those locations. And thirdly, we know as Pittsburghers, we love to get together. And we're hearing about porch parties and block parties in which neighbors are getting together and then the kids are going to play. We want to make sure that, again, we keep that social distance. You could stay on your own porch, leave your other neighbor on their porch, and maybe talk across the lawn. But we really want to make sure that that social distancing is so important for what we've done. In our parks, I've been to the parks over the last few weeks. It's really the only place I've gone other than the office and home, and have seen many people have been heeding our advice, which we're happy to see. We want to thank those individuals and we're grateful to those who are doing your part to limit the spread of the virus. What you will see in our parks, we put up these red, scary-looking signs to warn people that these are one of the things we need to do. We want to maintain physical distance of 6 feet or more, wash your hands or use sanitizer, and afterwards, if you use the restrooms, playground equipment, exercise equipment, or other items, make sure you continue to wash your hands. We want to make sure people are not playing contact sports. So if you're going, and then we'll put these big signs up at our basketball courts, at our deck hockey arenas, etc. We want to make sure, again, if you're out playing basketball, you can play horse, but you can't play 1-on-1, 2-on-2, 3-on-3, or 5-on-5. No contact sports. But we want to make sure that people continue to do that. We want to make sure, again, you stay at home or sick if you have symptoms. When passing people on the trails or on sidewalks, maintain that distance and warn others of your presence if you're coming up behind them. Cover coughs or sneezes with sleeve or elbow. Do not shake hands and do not touch your face. And yes, our parks employees and others are continuing to work, and you'll see them out in the at our parks. I want to thank our employees who have continued to serve the public through this time. They're going above and beyond and showing up and making sure we're protecting people. Because in government, we have the responsibility to ensure the health, safety, and welfare of our residents. That is the case particularly in these times of emergency, when residents rely even more on the services offered and performed by our county employees. We also have a part to play in helping slow the spread of this disease. As a result, working with all of our departments, Changes have been implemented for many of our operations while still continuing to provide the integral services that residents rely upon. Where accommodations are possible and appropriate to meet the goals of social distancing, physical distancing, while still maintaining the needs of the public, we're making these adjustments. Finally, before turning this over to Dr. Bogan, let me say thank you to the people out in the community who have really stepped up and taken the advice of our medical professionals. We are not out of the woods in any way, so to speak. This is a marathon, not a sprint. While we've gone a few weeks through this, and I think we're making progress, we still have a long way to go, and we want to make sure everybody continues to do their part by keeping their community safe, keeping themselves safe, keeping their families safe. So with that, let me turn it over to the director of the health department, who's really, her and her team have been doing so much to keep us safe. I want to turn it over to Dr. Deborah Bogan. Dr. Bogan?
Good afternoon, and thanks for joining us. As of today, the number of confirmed cases of COVID-19 in Allegheny County has surpassed 300. But we know there are likely many more undetected cases of the virus in our community. I want to take a few minutes to talk to you about why the number of cases we're reporting daily doesn't account for all the cases in our county, and to update you on our plans to deal with a surge if there is one. As you know, not everyone who's sick is being tested, and this, in most cases, is appropriate. Testing supplies are still in demand, along with personal protective equipment like gloves and masks for healthcare providers. So we need to be testing smart, and that is testing those who meet the criteria of having fever, cough, and certain risk factors like age or underlying health conditions, and healthcare providers. So if you feel sick with symptoms associated with COVID-19, are treating yourself at home, and you're not getting worse, you may have the virus, but don't need to be tested. You should continue to stay at home until 3 days after your symptoms resolve, and at least 7 days after your symptoms began, whichever is longer. If your symptoms are getting worse, and you are having any of the following warning signs, trouble breathing, persistent pain or pressure in the chest, new confusion or inability to arouse, or having bluish lips and face, please don't hesitate to call 911. We wish we could always know who does and does not have COVID-19 through testing, but right now we can't do that. Some people infected with COVID-19 do not have symptoms. According to some models, 40 to 50% of people with the disease may not show any symptoms, but may still be able to transmit the infection to other people. Other people have symptoms of COVID-19 may also test negative for the disease, likely due to a variety of reasons. This is called a false negative test and can mean that people think they don't have the virus but can still transmit it. So, if you have symptoms of COVID-19, even if your test comes back negative, please follow the isolation recommendations for COVID-19. For example, in households where someone's infected, other household members that start to show symptoms associated with COVID-19 should act as if they have the virus regardless of their testing. Rather than put yourself and others at risk, we urge you to act as if you and others around you have COVID-19. That's why it's critical to practice physical distancing, good hygiene, and stay at home as much as possible. Many of us are familiar with the common symptoms of COVID-19, cough, fever, and shortness of breath. But increasingly, we're learning of other symptoms that could also indicate that you have the virus. These include feeling fatigued or very tired, a sore throat, gastrointestinal distress or an upset stomach, like diarrhea, headaches, and loss of sense of smell or taste. You may also start to see more and more people wearing masks in public. There remains limited supplies of medical-grade masks, and we ask the public to reserve the use of surgical and N95 masks for those most in need, such as frontline healthcare providers. Homemade and other masks are fine to wear in public. In some countries, people wearing masks in public is a common sight. But it's important to remember that homemade and other masks are not likely to be very effective in preventing you from getting sick. The Czech Republic recently made mask wearing mandatory, but people there have a saying, "My mask protects you and your mask protects me." That is what I want you to remember. If you decide to wear a mask in public, it's not about protecting you, Rather, it's really to protect the others if you unknowingly have the virus but aren't aware of it. It doesn't mean you can stop practicing physical distancing or take less care washing your hands. We will provide additional guidance on masks as we understand more about what the risks and benefits of them are. For now, if people choose to wear a mask in public, please make sure you're not touching your face or the mask. Remember to put them on and off using the straps behind the ears, and wash your hands before and after wearing the mask. The number of cases and even deaths could become a bit frightening in the coming days and weeks if we start to see a surge. We're prepared for this and have been working with hospitals, emergency services, and others to really prepare. The U.S. Army Corps of Engineers assessed the use of the David L. Lawrence Convention Center in downtown Pittsburgh as an alternate care site if needed. The county has equipment including oxygen delivery systems and transportation if needed. Hospitals are busy shifting staff and operations to more acute care functions, and the Allegheny County Health Department's Medical Reserve Corps, a group of professionals from a variety of backgrounds, including practicing or retired medical and non-medical professionals and support staff, is prepared to provide additional support if needed. The best way to plan for a surge in cases is to take steps to prevent a surge. That's why it's important to stay home, limit your exposure if you do not have to go out in public, and wash your hands and stay safe. Thank you very much. Are there questions?
But that will turn to questions. The first is from the Mon Valley Independent. The question is asking whether the health department has offered or will offer any guidelines for municipal meetings. We know the recommendation is no groups more than 10, and the county is under a stay-at-home order. We're wondering if the department has told municipalities or other agencies to find another way to hold meetings other than in person.
I haven't specifically told municipalities to do that. However, I would strongly encourage them to hold virtual meetings like we've been doing here at the County Health Department for the last couple of weeks. Mr. Fitzgerald, do you have anything else to add?
No, I think that's exactly right, and I think we've seen county council has held meetings that way, and other conferences and meetings that have held. They obviously need to be held in a public setting, but they can be done virtually now under this pandemic.
From a couple of outlets, we're being asked if we can give an update to total testing numbers. The last update that we provided was Thursday. Or do we have a number at this time of how many people in the county have been tested to date, or how many tests are being given throughout the county on a given day?
I'm going to ask Dr. Brink, our head of epidemiology, here to answer that question, since she and her team really do track that very closely every day.
Sure, we're up into the thousands of tests. I'm not going to quote that number. I have it on hand. However, we are, over the past week or so, we have been testing about 500 individuals a day. And that's, just a giant increase that we're very happy about.
From WPXI, are there concerns about equitable access to testing throughout the county? The heat map from the county shows fewer cases along the Mon Valley corridors and the River Valley corridors. Are there truly fewer cases, or is this due to a lack of testing or access to testing?
That is an important question, and we are certainly looking at the heat maps. At this point, we're not aware of a lack of testing in any particular neighborhood, but we will continue to monitor that closely.
You may have answered this partially, but a few weeks ago it was reported that 40 to 60% of our residents could eventually be infected. I'm being asked, what do you attribute that number to, and are we on pace to still hit that number, or are we seeing progress so that we're hopefully nowhere near that percentage?
So those projections about the percentage of the world population that will acquire this virus at some point is based on historical models of other infectious diseases, and this one as well. When you introduce a new virus into the community that no one has ever seen, you need to get to a certain level of what we call herd immunity, where people have acquired, enough of the people have acquired infection over time to prevent it from spreading to others. And so those are estimates based on modeling of virus progression across large populations. There's lots of papers out there about those projections. Some say as little as 40%, some say as high as 70% of the population. And then again, that's across the world. In any one community, I can't say exactly what percentage will get infected.
There are a number of outlets asking questions about when additional demographic information might be available. Could you potentially talk about when that information might be available, or perhaps the challenges in providing that information?
So again, Dr. Brink and her amazing epidemiology team here really track all of this information, so I prefer that she answer those questions.
We have a draft dashboard that will provide queryable information that will address some of these gaps in our public-facing data, and that should be released within the next week. It's under construction right now.
From WTAE, Senator Pat Toomey is pushing masks for all, being asked if you agree with that approach, Dr. Bogan.
So in an ideal world where there were unlimited supplies of everything, sure, that would be great. But right now, unfortunately, we don't have masks for all. And if we did recommend masks for all, I'm afraid our healthcare workers who most desperately need them wouldn't have them. So although I think, again, in an ideal world, yes, we don't have that. And so please save the masks for our healthcare workers who need them, our frontline workers. Again, if you want to use a homemade mask, as I said in my presentation, that is fine, but it's not our recommendation at this time.
From Channel 4 again, WTAE, is there any way to estimate how many undetected or unconfirmed cases are in the county at this time?
We don't have a way to estimate that currently. I know there are people in our community interested in really studying that to find that out, but we don't really have a way to estimate it right now.
We have a number of questions from outlets regarding what the potential setup would be at the convention center. Is that something that the health department can answer, or is it something that we should be referring to emergency services?
That should definitely be referred to emergency services.
That's the end of the questions that have been submitted right now, but let's open it up for if either of you have any closing remarks, and if there's any questions that come in the meantime, we'll be happy to add those.
I just want to add that the county government and all of our healthcare agencies, our foundations, really, it's been an incredible demonstration of how people can work together collaboratively. I am so moved over the last couple of weeks in my entree into government work at the collaboration in this community. I am just overwhelmed and pleased with my experience to date. So thank you all for being such great partners and working together.
And let me add that to Dr. Bogan and thank her and her team here at the Health Department, but really all of our EMTs, emergency services, first responders, the work that they've been doing throughout this community, our healthcare providers at our various hospitals, folks who are working in our supermarkets, folks who are delivering food, folks, our social service workers who are helping people in need that are out there doing this. It just really makes me feel proud to be a Pittsburgher, to see all the work that so many folks have been doing. And again, we're at the very beginning of this. It's been a couple of weeks now, maybe a little longer than that. We still have a number of ways to go. I think we've been making some really, really good progress, listening to our medical experts, listening to the healthcare providers, and listening to their sound advice as to what we can do. And I know, again, as Pittsburghers, when we all pull together by staying apart, we can do so many good things, bend this curve, and then try to get back to as normal an operation, a normal life as we all want to do. So thank you, and let's continue working together. Thank you.